Friday, the 2nd of October. Today we're joined by Lucy Whiteman, our Director of Public Health. We're joined by Deborah Mattock from the University. We're joined by Jonathan Nunn from Northamptonshire Borough Council, Councillor Tom Beattie from Corby Borough Council. We have Simon Blatchley from Northamptonshire Police, and Katie Brown, who's the Director of Adult Services, and Paul Andrews, who works in the Children's Services at Northamptonshire County Council. Thank you very much. What we'll do is we'll follow the usual format that we follow each week. So we'll go to Lucy Whiteman first for her weekly report. Then we will come to Councillor Jonathan Nunn and Councillor Tom Beattie for their summation of the local situation as they see it currently. Then we will take the questions from the press that have been submitted in advance, and then we will open up to some more general questions if we have time. So thank you very much, everyone. And if everyone could please mute on coming into the meeting, and please put the name of their organisation on your screen so that I can see who it is that's asking any further questions. Thank you very much. I'm going to come straight now to Lucy Whiteman, our Director of Public Health, for her weekly update. Good afternoon, Lucy.
Good afternoon. Thank you, Councillor Morris. And good afternoon, everybody. So we've got somebody to share the slides. Obviously, since coming off of the Chief Medical Officer's watch list, it's a little easier to be able to publish our slides in advance. So I'm hoping that all of our colleagues have actually received a copy. As you know, this is available on the Northamptonshire County Council website and is updated every Friday for the week prior. So this data is up to the 27th of September. So as I said, we currently don't have any of our borough and district areas on the watch list. However, as Councillor Nunn has said before, complacency is still our biggest enemy. We do need to make sure that obviously people remain as vigilant as possible, and that we're still asking Northamptonshire residents to obviously not only follow the new national guidance, but also to remain utilising all of those best practice activities around social distancing, hand washing, etc., that we've been reinforcing in Northamptonshire since the beginning. So if we can just move forward. So obviously, just a quick summary for the new government guidance, and obviously we've provided links so that the public are able to get easy access to the ever-changing information that is around. Obviously, currently our position means that we are broadly sticking with the national guidance. We don't have any additional restrictions placed at a national level on us, but as I said, we are still making sure that people are adhering to the local recommendations as well. So if we can go forwards. We continue, as I said, to work and urge all residents to work with us to continue to avoid a local lockdown. We've been very fortunate in as much as we've been able to come off of that medical officers list without significant intervention. However, we are still seeing rates in certain areas that I certainly am not comfortable with and that do still require further work. We continue to obviously ask that no sporting gatherings and tournaments, multi-team tournaments, are happening across the country, across the county, and we continue to work with our police, our environmental health and our licensing officers to ensure that enforcement is undertaken wherever necessary. If we can move on. So these obviously, as always, are our key messages around keeping 2 meters apart at all times. So following that rule of 6 that the government has introduced. So if you must meet people outside of your household or your support bubble, to do so outdoors. And I do recognise that in our glorious autumn English weather, that's not always a particularly desirable option, but it's absolutely essential that people retain that practice or recognise the fact that if they're not willing to do so, that indoors, if it's outside of the rules of 6, is not appropriate, and therefore obviously that we will be monitoring such levels of compliance and taking enforcement action where possible. You still shouldn't be sharing items with people outside your bubble or household, and wherever social distancing isn't possible, for example on public transport, etc., then using a face covering at all times. You must continue with some of those basic hygiene measures around hand washing, and obviously in line with government requirements, we are asking people to work from home where they are able to do so. So we can move forwards. Again, just reinforcing some of those basic practices, but obviously making sure as well that we continue to ask people to actually cooperate with the local and national test, trace and isolate process. This is key to us maintaining or improving on our current position. If we are unable to identify where COVID is and therefore unable to stop that onward chain of circulation, then we are not going to improve on our position, and certainly we could see our position escalate as we have seen in the north of the country. So it's key that people do actually help coordinate that response at a community level. So if we can move forwards. So again, just reinforcing that one of the easiest ways to be able to help us identify when people have been exposed to risk, and obviously identify who that they may have exposed to that risk, is by downloading the NHS Test and Trace app. I do recognise, and the government is working on some of the issues around the usability for certain phone ages and different phone types. I do recognise that is a challenge, but it is still one of the best tools that we've got in our toolbox to fight against COVID. So please, just encouraging people to utilise that where they are able to. So if we go into the data, so for the week up to the 27th of September, you will see our total is now just over 5,000 cases, so 148 in the week between the 21st and 27th of September inclusive. Pillar 1 testing, so 16 cases, and people will recognise that that is an increase on previous weeks, and we've talked about that being a likely outcome of NHS services restarting and obviously that routine screening of staff. So we're starting to see that play out now with more positive cases being identified in Pillar 1. In Pillar 2, 132 cases being notified through our community and mobile testing units and through home testing kits. That is obviously still a low number compared to other areas, but as I said, complacency is our worst enemy, and our cases still do remain high compared to our position in previous months, and that's the position that we need to get back to. So if we can move forwards. So again, still our younger population that are obviously most at risk of catching COVID at the moment. That's playing out obviously in the number of positive cases. We do continue to have that bias in female cases, and that is likely to be because of their health-seeking behaviour. So I would encourage all men, again, if they are developing symptoms, to seek testing to make sure that we do identify where cases are. Women do tend to be more forthcoming in seeking testing, and that's just a general health-seeking behaviour, as I've said, not specific to COVID at all. Again, 20 to 29-year-olds and under 20s are still seeing increases, but you can also see here that the 50 to 59-year-old adult age group is also seeing an increase. So it's really important that in that working age cohort, people continue to maintain best practice. Particularly as we get older, we're also more vulnerable to COVID, we're more likely to have another long-term condition, and therefore we need to remain vigilant for symptoms and make sure that we do support each other by protecting each other if we become a case through self-isolation and contact tracing. So if we move on. With regards to our boroughs and districts, not as positive a position as last week, as people will see. So although the overall Northamptonshire rate is still reducing, we've had an increase in Daventry, East Northampton, South Northampton, Wellingborough. We move forwards. So our case rate here, obviously when we try to compare each area, that's the best way of acknowledging the position at any one time. So our rate per 100,000 for each population area, you can see there that Corby has the highest rate at the moment in Northamptonshire. And although similar to the Northamptonshire overall rate and lower than the England rate, we have to understand the context here that nationally the rate has escalated so significantly and so rapidly that we look comparatively better. But being the best of a bad lot is not good enough for us locally. We need to make sure that we get those rates, particularly those that are 20 or above, back down under the 20 per 100,000 rate to know that we're in a more secure position for the long-term health of our population. If we move forwards. Again, you can see this very well illustrates the fact that the England rate, that dotted grey line, has increased significantly and steeply over the last weeks. So although, as I said, we look like we're in a better position, it's relative to that significant increase in other areas. Again, still demonstrates that we've got work to do, particularly in the areas that remain above the Northamptonshire average. The next slide. So school status, and we've obviously got our school cell pool on as well to answer any questions, but active outbreaks have reduced, so we're now at 5. Obviously small numbers associated with those, only 21 cases associated with those outbreaks. Again, a really good increase in the number of schools that are attending and pupils attending. Obviously slightly down on this position compared to the previous year, where some people are obviously choosing to retain education at home. But you can see the position here is really positive with regards to our schools. And again, my congratulations to the school cell and to all of our head teachers for managing the reopening and the restart of this term so positively, and for getting all of our children, most importantly, back into that mainstream education. Really, really good for their long-term chances, but also for their physical and mental well-being. So really pleased to see our position and hoping that obviously it continues on this trajectory. Next slide. So I'll skip over these. We see these on a regular basis. We know that Corby, as I've said, is our current area of focus, and you can see that reflected in the cases in the community in the last 28 days. And obviously our overall rates remain higher in our more densely populated areas, and as seen here in Northampton and Kettering. So if we skip through. So again, as a comparative rate, our focus remaining on those same areas. If we keep going, and the last two. So summary of outbreaks, people will be pleased to see that obviously outbreak numbers still remain low. You can see that our Green Corps numbers are still within our confirmed cases. So the overall number of cases affected continues to look high, but we should see that change next week as the Green Corps effect obviously works its way out of our record process. At the moment, we've got 15 outbreaks, current outbreaks in care homes, 5 in workplaces, those 5 in schools and colleges, 1 in a hospital or a hospice setting, and 2 others in other settings. And obviously, we talked about that they're wide and varied. They could be congregations of religious groups, they could be sports clubs. There's a wide variety of different organisations and settings that come under other. None of those currently have high numbers of cases that are of concern. Again, at the moment, we've still got exposures being reported to us, but we have talked about the fact that that data delivery may change. And clusters, obviously, it's useful for us to see where those clusters are. We do know that household clusters obviously continue to be the main issue. So where we have one case, we very often do see other cases within that residential home setting. And again, it means that we need to and must continue to reinforce what social isolation means within a home setting as well. It isn't just remaining home, but potentially still actively socializing with the rest of your family members, but isolating even within a room within your home, and obviously requiring that family support to support you to do that. So obviously we've got communications and resources around that, and quite happy to share those again if our press partners are interested. I think that's the end of the presentation. I think obviously the rest of it is summarising the activities that continue to go on, and I'll leave you to read that information in your own time. But Councillor Morris, happy for you to obviously pass over to our council leaders.
Thank you very much. Thank you very much, Lucy. As always, a very succinct summary of the weekly figures. Before I go to Jonathan Nunn, I just wanted to say that we're not going out live today. I didn't say that earlier, but we are recording, and it will be uploaded as soon as possible after the meeting for those that are wondering why it's not going out live at the moment. It will be available as soon as possible after the meeting. Thank you. So I'm going to come now to Councillor Jonathan Nunn, the leader of Northamptonshire Borough Council, for his view on where we are at the moment. Thank you, Jonathan. Good afternoon.
Good afternoon, and thank you, Ian. Good afternoon, everybody. It's a similar picture really to last week, in that naturally we are extremely proud that Northampton and Northants as a county has stats lower than the national average. We have to note that, We can't necessarily celebrate it, sadly. We can't get complacent about it, but we have to therefore use that to identify once again that you can make a difference. And the extraordinary extra lengths we've asked people in Northampton and Northamptonshire to go to clearly shows in those figures. That's the one lesson we can draw from that. But as Lucy says, complacency remains our enemy, and we must seek for people to follow the guidelines as closely as they can. And that's going to get harder. Again, as Lucy says, look at the weather. Northampton today, I don't think it's stopped raining all day, and that makes it very, very difficult. It's very, very difficult to meet with people if you're going to sort of meet them in a town environment, if you're going to try and meet them in your gardens. I know many, many people have tried to stick to. That's going to be harder. The start of the lockdown period, one of the small consolations we had is we did get in that earlier period, sort of April, May time possibly, some really nice weather, and that helps lift the mood and so on. I suppose I'm conscious of the impact that has on us all as we now drag through the months and months of this as it goes on. We look forward, I think it's next Saturday, to just getting an echo there slightly.
No, you're right this end.
Oh, am I? Okay, sorry, that may be my headphones. As we look forward to World Mental Health Day, which I think is a week on Saturday, you know, there's probably never been a greater risk of a mental health pandemic, possibly as a spin-off from the virus pandemic. So that's just one of the, if you like, the rotten spin-offs that have happened as a result of this. But we must urge people to do everything you can, please, to adhere to the guidance that's been given. And one of the things there is the app. Do you know, I've spoken to a lot of people now who are using the app. They remark how incredibly easy it is to download it. I personally use it for the first time when I stood at a venue that was asking me to download it. And I think I checked in ever so quickly. So, you know, within less than a minute, I downloaded it and checked in. We would urge you to do that. A reservation's been raised by a couple of people with me, and this may be the forum to mention it. People are concerned that it'll tell you you're checked in the venue till midnight. So does that mean if I'm in at 10 o'clock in the morning, someone who develops the virus who's in at 5, am I then going to be forced to self-isolate? The answer is no. It's a warning. It guides you to be alert that you may have been mixing, but the time is then explored more clearly. So don't feel there's any danger of you being unfairly treated by that. The answer is to check in for your own safety, the safety of others, and the safety of your family. Finally, a little bit perhaps around the economic impact of this. There's a question later which I'll probably explore a little bit more, but it is continuing to have a significant impact, including the curfew, which is continuing to impact quite negatively on the economics of the town. And whilst we know we continue to take precautions, we do now have to settle into a life as normal. And I have a huge concern over the impact. The curfew is making a significant impact. Footfall in our town in the 4 o'clock till 11 o'clock slot is now down by 12% week on week. So there's a significant thing that we have to deal with there. And what that says is we want to get places open in the evening. Actually, we want to get everything open. The only way of doing that is really knuckling down, sticking with the precautions, and going as we have done in Northampton and Northamptonshire, from being an area of high concern to an area of average to now possibly we might say let's push ourselves towards being a beacon of good practice and some really, really low rates. I think those are my thoughts at the moment. Ian, happy to come in on the questions that come a little later.
Thank you, Jonathan. Very good observations as always. I'm going to bring in Councillor Tom Beattie, the leader of Corby Borough Council now, to reflect on the week and how he sees the situation as it is currently. Over to you, Tom. Good afternoon.
Good afternoon, Ian, and thank you. I sort of reinforce, I think, some of the things that Jonathan has said previously, which is about the need to avoid complacency and to encourage our residents to continue to follow the advice that we've been giving them for the last number of weeks, if not months, which does seem to have had an impact. But bearing in mind the comments made by Lucy earlier about the national picture, I think it's still a concern that, for instance, for us here in Corby, we're still the highest in the county at a figure of 31.1 per 100,000. That would have been high just a couple of weeks ago, I think, given the fact that, you know, the national situation has changed. And we're not quite as bad as what's happening elsewhere. It doesn't mean to say that we're out of the woods. Clearly, the national picture is concerning, and the government have taken decisions in other areas of the country, which I would hope we can avoid here in Corby and across Northamptonshire more generally. I've spoken in the past about how I would, really want to avoid any form of local lockdown, and I think my appeals to people to follow the advice and guidance has largely been followed. There are instances clearly where that isn't happening. Those people will continue to receive, education, advice, and guidance about what they need to do. I know the police have now decided that they've moved on from simply a case of identifying bad practice and telling people to behave themselves, and in effect to actually enforcement, and that in itself will have hopefully a positive impact. It's good that, last week when I spoke, we hadn't had the decision about whether we were still on the government watch list. We did come off that, and I'm pleased to be able to say that happened, and that's still the situation this week. But just to continue to urge compliance. I echo Jonathan's comments about the impact that this has on people's daily lives as we move into autumn and then into winter, and all of the difficulties that will bring with it, impacts on people's behaviour and health. But we don't ask these people to do these things for no reason. I think we need to get on top of this situation. The advice and guidance that we give is given for a good reason. We would ask people to continue to comply with that, and hopefully we will move to a situation where we're below the national average, but where we're significantly, I think, below the national average in weeks to come would be a good target to aim for. So I think that's as much as I want to say at the moment, Ian, but happy to answer any questions that anyone might have. Thank you.
Thank you very much, Tom. And I think we all echo yours and Jonathan's views on that. I'm going to come to the questions that were submitted in advance next. I'm going to come to Alistair from the Chronicle and Echo first. Alistair, are you there? Good afternoon.
Good afternoon. Can you hear me?
Yes, we can hear you. Well done.
First, all right. Thank you very much. Yes, I think I've got my first question for Lucy Whiteman, if that's okay. Yes, as I say, Lucy, we're nearly a month into schools returning at this point. Would you say there have been greater or fewer cases across Northamptonshire than you were expecting when we first started? I guess depending on that answer, what are the reasons behind that?
You, Alistair. What we're going to do is bring Lucy in on that, and also probably Paul as well on in a moment as well. So Lucy, if we come to you first, then we'll come to Paul. Thank you, Lucy.
Yeah, hi, Alistair. Really good question. I think you will remember my nervousness about school term starting, and me saying that cases and outbreaks were I think a case of when as opposed to if. Indeed, we have had them, but far fewer than I would have expected. And I think that just demonstrates quite how effective our communications have been around what the measures are that people need to be undertaking. And because areas of Northamptonshire have gone onto that list, those communications about best practice, I think we've kind of conditioned the public almost to reinforce the hand washing, the social distancing, etc. I also cannot, as I said earlier, express my gratitude enough to the school cell and to our head teachers, because they've created safe environments. We will never eliminate risk. And as I said, that was reflected in my nervousness when we were talking about the return to school. But because of the fastidious nature within which they've enacted all of the guidance, they've created different rotas and shifts and staggered starts and ends of schools. We've seen compliance and understanding in our youth and our children that I don't think even I recognised quite how well they would understand the risk, and therefore how actively and encouragingly they would rise to the challenge of maintaining best practice within the school setting. We're in the position that we're in. we don't know what's around the corner. You know, we are likely to continue to see cases and outbreaks fluctuate throughout, you know, obviously the whole of the school year, quite likely. But at the moment, we're in a much more positive position than I had anticipated. And that's why I'd like Paul to come in to talk about some of the measures that the schools cell and the schools themselves have undertaken. But as I said, they've worked so closely with our teams, with environmental health, again, just providing support and advice. And the head teachers and you know, the pupils and the families themselves have really risen to the challenge here, and I can't thank them enough.
Thank you very much, Lucy. Yes, I would like to bring in Paul Andrews as well as one of the very hard-working team in the education cell that have done an awful lot of work with the schools. Paul, can I come to you?
Yeah, thank you, Councillor Morris. I'd echo most of, well, everything that Lucy said, but I think I'd like to pick out one group in schools that often go unnoticed, and that's children and young people themselves. All the reports that I've heard from head teachers have been around how absolutely incredibly well the children and young people have done in following rules, following the guidance, and actually I think often young people in our society are often viewed in a negative way, and I think this has been a real example of how as a group of young people in our society, children and young people, they've actually done exceptionally well, and I think we should mark that in some way if we can. Yeah, I think that's about all, because I just don't think we talk about the value of our children and young people enough, and I think in this circumstances they've been absolutely fantastic and deserve credit.
Thank you very much, Paul, for that, and I think we would all echo that. It is a team effort. The children are part of that team in the fight against this virus, and it's heartening to see that they are joining in the battle, if you like, with everyone else against the virus. Alistair, did you have another question?
Yes, please. Almost a follow-up, if that's okay. Another one from maybe Lucy and Paul. Let's think. During this week, I've heard thrown around this idea of a fire break as we approach the October half term. Kind of an idea of extending or that break or giving more time of about 2 weeks to almost allow things to sort of, the fire break kind of illustrates it quite well, to give time for things to reset and to come back fresh. And it's a hard one to illustrate, but the idea of more time at half term or more time at home, just to let any more infection, any more outbreaks play out, then we come back knowing what's what, basically. Would you support that kind of idea in Northamptonshire? Would you see that as a necessary step?
Thank you, Alistair. I think what I'll do is I'll come back to Paul first, and then if Lucy has anything extra to add, she can come in on that as well. But Paul is the area of expertise in this matter. So Paul, over to you.
Thanks, Councillor Morris. Alistair, I'm not aware of any plans in that regard. I personally wouldn't see that as necessary at the moment. I think what's apparent from, as we've just been talking about, is that the systems that schools have put in place and that head teachers have put in place and that everyone is working very hard to comply with appear to be having the effect that we would want them to have. So I don't see a reason when we're trying to catch our young people up why we would take another week when it's not absolutely essential.
Thank you, Paul. Lucy, did you want to comment on that?
Only to say I completely concur that there's no evidence, there's no data that suggests that that's a requirement. As Paul says, you know, our children have missed out on months of education, and albeit it would only be a week's extension, you know, at the moment I just don't think that our children can afford any further time out from education, both for, as I've talked about before, their mental well-being as well as their actual learning ability. The only other thing I'd say is that actually, if you look at, as I mentioned before, our communication of the virus tends to actually be more so in household settings. So actually, when you look at how few outbreaks we've had in schools, it suggests that they are probably more COVID secure than our actual residential housing at the moment. So again, there is no evidence to say that they shouldn't continue their education, and I'd actively encourage that until our circumstances change.
Thank you, Lucy. Alistair, I think you had one more question, if I'm not mistaken.
Yes, please, that's okay. Thank you for that, Lucy and Paul. I guess there's one for Lucy, invite anyone else on this one. Of course, there's been a recent expansion on the number of people who can now qualify for a flu vaccine. I was going to ask you, how do you think the county will cope with the increasing demand? And do you have any messages for those who will now qualify?
Thank you. Thank you, Lucy.
Yeah, hi, thank you, Alistair. So yes, I mean, obviously one of the complexities with COVID as we come into winter is the fact that we also have the threat, as we do every year, of seasonal flu. Obviously at the moment we don't have a vaccination for COVID, but we do for flu. As you quite rightly say, the eligibility has been extended this year to include children in year 7, to include all residents aged between 50 and 64, and also the wider household members of people who were on the shielded list from earlier in the year. So a significant increase in the number of vaccinations, and actually locally that makes, I'm trying to look at the stats I've got to one side, it makes 380,000 of our population now eligible for a vaccination. So you know, that's more than half of the Northamptonshire residents. Clearly that's going to be a significant operational undertaking, and there has been now for a number of months an STP, so a county-wide flu planning group. And we've got a number of delivery mechanisms put in place that utilise both the voluntary sector, our community pharmacists, primary care, so general practice as well, obviously our acute settings there, or occupational health settings, as well as our community healthcare trust and our private providers. So we've got a number of options for delivery of the vaccination. We've got programmes of work exploring mobile vaccination units, so outdoor-based drive-through vaccination, but also from a point of view of looking at how we will amalgamate that with a COVID vaccination schedule should it be required. Obviously, we still await further details of whether that will be delivered this winter. It is complex. As I said, it's a significant undertaking operationally. At the moment, we're confident that our plans will deliver to all of the eligible population. Our challenge will be as it quite often is, the national supply chain with regard to the vaccination itself. I'm quite happy to give updates periodically as we go through the winter should these press conferences continue, but obviously also privately should the press conferences not continue, happy to respond to any media inquiries as we go through the winter, because it will be complex. We will need to make sure that our communications are clear, particularly if the second COVID vaccination comes into play as well over this period. But at the moment, we are confident that we've got a plan in place to deliver, subject to the availability of the vaccine itself.
Thank you very much, Lucy, and thank you, Alistair, for those questions. Very good questions. I'm going to come to Jack Duggan now, who's also from the Chronicle and Echo. Jack, good afternoon.
Hiya.
We can hear you. Yes, you're all good.
Fantastic. So yeah, mainly to Jonathan really touched on the economic impact and sort of concerns he has, and the effect of coronavirus sort of closing down businesses in the town centre and footfall being down. So, you know, I just had TSB announcing they're going to close their branch. Just wanted to ask what sort of predictions you have for the future, what support maybe you think the town centre might need, maybe from the government or from anyone else, and how this might affect the council's plans for developing things like the marketplace and the old M&S site.
Thank you very much, Jack. Over to you, Jonathan.
Yeah, thank you. Thank you for the question, Jack. Yeah, I mean, any closure is really disappointing, isn't it? That's probably an understatement, actually. You know, it's awful. It's awful. What will come to fill them, who knows? I suppose overridingly, that the change in town centres we already saw before COVID is just accelerated enormously since the COVID, hasn't it? You know, we might have expected to be here after another couple of years or something. We've come quicker and quicker. The online shopping and so on has accelerated, but naturally it's very, very disappointing. So I think what do we predict? Can we pop the other speaker on mute possibly? Is there a host that can do that?
Sorry, I was still on.
Oh, beg your pardon. Sorry. Okay. Thanks. I thought there was somebody else talking.
Don't worry. Carry on.
Okay. Great. So yeah, the point, Jack, we're further forward than we thought. I suppose this is where we thought we were going. Not that I had a crystal ball as to exactly where that was, but we saw a massive change in town centres. We're further along than we thought. What support do we need? I think we need two things. One, without any doubt at all, we need public intervention, and we've seen that with the Future High Street scheme and schemes like that. It's a time of such dramatic change that the market, if you like, I don't mean the marketplace, but I mean the commercial rental market is not ready to change and adapt, so the buildings like Marks and Spencer's, that their viability to put into a constructive, positive use that will improve the town is just not commercially viable. The councils and the government need to stand in. That's why we bought that, and we're glad that the government support seems to be maintained. They've recently announced that they've given us £1 million where we'll start the refurbishment of that. So I think it's two types of support. It is more government support and council support for sure. So far, we've just been lobbying the government, or not lobbying, but we've been keen to ensure that the government stick to the schemes they had on the Future High Streets and the Towns Fund, which they have, and they've paid money out on that. The second part of that, so we're not clear what we'll be asking for them next, but there won't be much money around. Second part of that is they need shopper support. And I still stand behind the work we are doing to promote the town, not because we want to risk people's lives, but as asked last week about our promotion video, it is safe to come into town if you can. What we need, frankly, is we need people to come in. We need them to shop, we need them to eat, we need them to spend money. You can do that safely. The footfall is slightly up. If you take another part of the day, which is the earlier part, between 8 and 4, more people are slowly coming back into town. We urge them to continue doing that, and we would urge them to please do it safely, because it is safe to come into Northampton. Slightly fragmented answer, Ian, I apologise, but I hope that's
okay. Jonathan, very succinct as always. Thank you. I know you were interrupted by some background noise there, so you did very well. It's not always easy when there's background noise. Jack, coming back to you, did you have another question?
Yeah, no, that's great. Thank you, Jonathan. I was just going to ask about the hospital, and I was just wondering how it's planning ahead for the winter months. Obviously, that's the time when demand goes up significantly, and even before COVID, hospitals were struggling in parts of the country. Just wondered what level of increase in demand it's expecting this winter, and what areas those might be, obviously, as well as coronavirus, naturally.
Thank you very much, Jack. Yes, Joanne Watt isn't joining us today, but Lucy's very happy to answer that question, I'm sure. So over to you, Lucy.
Yeah, thank you. I think it's a really pertinent question, as you quite rightly say, Jack. There's been significant increases in hospital activity in relation to COVID in other areas. At the moment, I am in a position where I can confirm that we haven't seen that same increase, but as I said, things, as we know, can turn on the flip of a coin, and when COVID escalates, it escalates rapidly. At the moment, we've got 11 beds occupied by COVID positive patients in the county, and that is just under 1% of our bed base. So at the moment, we obviously do have a low incidence that has resulted in hospital admission. Having said that, we obviously have been reopening services in the NHS, so our overall acute settings are extraordinarily busy. So if we see an increase in demand around COVID treatment, then it will put significant pressure on our NHS services, and indeed we may end up seeing, as other areas are having to, us going back to a position where we can't undertake the business as usual services, which poses a different type of risk to our population. But I thought it was important that we started to sort of share some of the figures with you around the NHS demand, because we need you to understand the context, and should that change over the next few weeks, be able to give you a building narrative. One of the things that has been clear over recent weeks is an increase in primary care demand for complaints associated with COVID, and also in our 111 demand around complaints, again, associated with COVID, so symptoms relating to COVID-19. Again, that historically has been a precursor to an increase in acute activity. We don't at the moment expect it to have the same impact as it did the first time round, simply because at the moment the majority of cases are affecting a younger population who tend to have milder symptoms or who are asymptomatic, as we know that's part of the challenge of obviously getting on top of this. But it is not to say or underplay the level of vulnerability that still exists in our wider community, and that if we don't continue to operate in the way that we are and stop that onward transmission, particularly within households, which is, as I said, the main cause of our continued case increases, then we will potentially see older, more vulnerable people back in our acute settings, and we know that the outcome there is quite often not good. So we are happy to keep you updated. One of the things that I will share with you as well is, because we have this window of opportunity where our rates are slightly lower, I know that all providers, both adult social care settings and our acute settings, are considering whether they will be able to allow visiting for, a short period of time. That will be dependent on each individual provider's risk assessment. So not all providers will be able to offer that service, but we wanted to try and take, as I said, a window of opportunity with slightly lower rates to allow loved ones to get back in contact with those in, residential or long-term care, or in our acute settings, subject to each setting being able to facilitate that. So that is good news, but we will obviously reassess that week on week as we go through this pandemic. And should our position change and our case rates increase, we may well obviously have to revert back to the position of no visiting.
Thank you very much, Lucy. Jack, did you have a subsequent question?
Yeah, just so the thing about visiting, so is that sort of hospitals and care homes, essentially?
Shall I?
I was about to say, Katie Brown from Adult Social Care may want to come in, but the discussion, as I said, between chief execs, particularly of the acute providers and the community healthcare trusts, has been where that can be facilitated, they will, but obviously that's going to be subject to each setting's risk assessment and also the capacity of the staff and the physical environment to be able to facilitate that. So you may see different organisations taking different approaches, but Katie, you may want to add something about adult social care settings.
Thank you very much, Lucy. If I bring in Katie Brown, she's the Director of Adult Social Care and Services in the county. Hi, Katie.
Hi, thank you, Councillor Morris. As per some guidance around the Adult Social Care Winter Plan that came out 2 weeks ago, it is at each local area's discretion between the Director of Adult Social Services and the Director of Public Health around the guidance they give to care homes based on their local circumstances. And just to reiterate what Lucy has just, individual care home being able to facilitate all the guidance that is there around stringent health protection, PPE. These are things that we've been supporting our providers with over the last 3 or 4 months and beyond. And we want to just make sure that everyone has the opportunity, whilst we can do that, to see loved ones in case the situation changes. It will be on a case-by-case basis, and each care home, it is at their discretion whether or not they choose to enact that. But obviously we will support with supporting risk assessment and guidance should they require it.
Thank you very much, Katie. Thanks for that. That was really helpful. I'm going to come now. I've got a couple of hands up. So I'm going to come first to Neil Barber from ITV Anglia. Good afternoon, Neil.
Hi, just 2 questions, one for Lucy and one for Jonathan. Lucy, you mentioned about men not being particularly, not coming forward quite as willingly as women. How important is it that they do come forward if they've got symptoms for you to get a full picture of the infection rate around the county? And Jonathan, we've spoken to businesses, including pubs and restaurants in and around Northampton, and they say they're barely turning a profit, and a lot of it is down to the new curfew law. What would you say to them, those people who are watching their businesses fall by the wayside because of those restrictions, and do they need to be eased or changed in some way?
Thank you very much, Neil. Great questions. I'll come to Lucy first, then Jonathan. So first, Lucy.
Yeah, absolutely. Men, yes, absolutely. This is an age-old public health issue. Women do seem to, for whatever reason, be much more willing to engage in healthcare, and that's both from a screening perspective but also a treatment perspective. They're much more likely to present earlier with a complaint to primary care, and they're much more likely also to get a referral quite often into secondary care at an earlier point in a disease process, because they engage and they're more open with their symptoms. Whatever the reason is for men not engaging, particularly in screening processes as openly, as you quite rightly say, it's part of us being able to understand what the full picture is locally. The test itself, although not pleasant, I won't lie, it's no a day in the park. It is quick and it's simple. It's a swab to the back of the nose and the back of the throat. So if anybody has got symptoms, but men particularly, please, as soon as those are demonstrated, get yourself a test once you've self-isolated and wait for those results, and only come out either with a negative test result or after you've isolated appropriately should you get a positive test result. It's key, as you say, that everybody accesses testing as soon as they've got any symptoms for us to be able to get that full picture. And for whatever reason, if we can encourage men to go and get testing as frequently and as openly as women do, that can only be a good thing for us to be able to really get to grips with the full picture locally.
Thank you very much, Lucy. I feel chastised as a man, but I shall endeavour to get tested should I have symptoms, and I would urge everyone else to do the same. Jonathan, over to you for that second question.
Yeah, thank you, Ian. Thank you very much. Happy to answer this, Neil, although it's a real thorny one, isn't it, frankly? Your comment, and I know it's only a phrase, but you use the phrase barely making a profit. I wouldn't be surprised if there are many who are now trading at a loss in the hospitality trade in Northampton. It's a guesstimate. I'm not close enough to it, but I do know.
Join the meeting.
I do know how incredibly hard it is to run a business. It is incredibly hard. And those in hospitality had a period where, as we said before, their tills weren't ringing at all. The Eat Out to Help Out seemed to inject a bit of a, should I say, shot in the arm. It seemed to, get them going to recover some of their sort of losses. But I do know that the peak hours for that trade are now not available to them. They're very limited. So I've huge sympathy for that. And I don't know what to say to them direct, other than I understand, and perhaps the things I've already said. I know how incredibly hard it is. I have a meeting later today with colleagues from the Business Improvement District to try and get some more immediate feedback as well. And I do understand if they put forward, an argument that they feel this is not the right way to tackle it, then that's one for me to consider, and how we support them. But ultimately, we've got to be focused on the public health side of this. And what I would really hate to see is them all locked down again. I would hate to see it that we could only access, shall we say, our supermarket and food retailing stores and the limitations we had back in the spring. That would be awful. And the thought that they would have to close their shops altogether with the extra investment they've made, reorganising tables, kitting themselves out with perspex screens and all that, to see that wasted and they're shut down altogether, because I do know if they were shut down altogether, I do think enough of them are close to the edge that we'd lose an awful lot more. So for the moment, we've just got to knuckle down. Not shy, and I intend to talk to them through the Business Improvement District, and happy to talk to them face to face, because their interests and the interests of the town are important. But ultimately, I think my gut feel falls on the side that we've just got to go along with it at the moment. We've got to knuckle down, and we've just got to make sure that we get these infection rates down nationally, and to them and to all the other people who've had their lives so badly impacted. Naturally, I have huge empathy and huge sympathy. I'm really, really sorry for what people are suffering. Thank you, Ian.
Thank you very much, Jonathan. Neil, did you want to come back on anything there since you're on the line?
No, that's absolutely fine. Thank you.
Thank you very much, Neil, and thank you for your questions. Much appreciated. I've now got Laura Coffey from BBC Radio Northampton. Good afternoon, Laura.
Good afternoon. Hi. Just a couple of questions. So firstly, with the active outbreaks, you've seen a reduction from 39 the week before down to 28 for the figures up to the 27th of September. Why do you think that is? And is I'm guessing that's seen as a positive. So what's being done to try and get that reduction? And also, I just wanted to find out a little bit more about the geolocate messaging service that was used in Kettering and Corby. I know that was for a 2-week period. I just wondered if there was any kind of outcomes from that, kind of what was the result of the use of it? Did you see the numbers that you wanted? And was this seen as a cost-effective way of getting messaging out to people?
Thank you for those questions, Laura. I'll bring Lucy in on that first bit, and then I'm not sure if we've got anyone on from comms that can answer that second bit, but rest assured we'll get an answer to you, and Lucy may have some information on that. If she doesn't, we can find a comms colleague to either give you the information afterwards or answer the question on the line. Lucy.
Hi, Laura. Thank you for your question. So with regard to outbreaks, I think, to be honest, one, there's a little bit of luck, but two, I think this is about the fact that we've got really strong messaging, and actually people are starting to get into a rhythm with regard to best practice. I say a little bit of luck because, as we've all seen, it only takes 1 or 2 cases that are not identified because people are asymptomatic to, you know, sort of end up spreading within a particular environment, and we have an outbreak on our hands. So I would never be complacent and say that we've got completely on top of it. But, you know, we've seen a lot of our settings now settle into a rhythm around staggered start times, staggered finish times, be that in schools, be that in factories around shift working. We've got used to wearing PPE. We've got used to that ritualistic hand washing. So I'd like to think that this is starting to become sort of business as usual for people. But as I said, I don't want to be complacent. I do recognise it's only when we get the testing, when we're able to identify early that we've got a case and able to follow through with appropriate self-isolation, do we actually manage to maintain a positive position. So we will see fluctuations in outbreaks as we go over time. But at the moment, as you quite rightly reflect, our position is positive. But there, by the grace of God, go we, and that could change. But I know we're seeing good compliance. I know our EHOs are working hard with our providers, and you know, as Jonathan's just reflected upon, our businesses know that good practice, looking after their patrons, taking all the appropriate steps, and being seen as a good business and a safe business to engage with is also making sure that our residents and all of those staff within those businesses stay safe. So not only is it good from a point of view of making sure that our economy stays live and stays moving, but it does also mean that obviously we're protecting those that use those services. So it's a bit of a combination of everything, but I don't doubt that this will continue to fluctuate over time.
Thank you very much. And in terms of the geolocate question, I think Catherine wants to come in on that from comms. Catherine, are you there? But otherwise we will provide the information afterwards. Catherine, are you there?
Hi, yeah, certainly can explain about the purpose of it. So it was during the period where we had the spike in the 20 to 29-year-olds in particular, in the Corby and Kettering areas, and we were trying to do some different comms, try things that we hadn't done before to really try and reach those audiences. So the geolocate function, it allows messages to appear on people's mobiles when they're in an area that we've designated as an area that people within where the message would show up. So you might go to a pub in Corby and the message that you were in an area of higher risk would flash up on your screen. So if you were, say, visiting from Leicester or Nottingham or another area of the country and you weren't aware, you would get that appearing on your screen. I don't have the stats, but we can look those out for you and send those through.
Thank you very much, Catherine. And that would be very helpful, I think. Laura, did you have any further questions?
No, that's great. Thank you. Yes, if I could just get that information, that would be brilliant. Thank you.
We'll share that outside the meeting. Thank you very much. I'm looking around the room. Has anyone else got any questions? I'm not seeing any other hands, except Lucy wants to say something. Sorry, Lucy, you raised your actual hand, not the mechanical hand.
I did, not my virtual hand. I'm sorry,
Yeah,
I'm confused.
all right, don't worry.
And Laura, I mean, it's a bit of a cheeky question because actually this doesn't usually go this way. Usually you ask us questions, but you know, with the geolocate work, obviously what we've been really conscious of is that people are getting fatigued with the messaging, and if we don't change it and target it, we are quite likely for people will become immune to some of the messages. So we would, I'm sure, value the opportunity that if any of our media colleagues have got any insight into what works really well, or if they've heard what works well elsewhere, if you're able to share that with us, then we would really appreciate it, because I've cited you quite often, as in the media generally locally, as being one of the weapons that we've had locally. You've helped us, you know, immensely communicate those messages to the public. And again, I'm sure it's one of the reasons that we've seen the level of compliance and understanding that we have. Yes, we don't always get it right, but you've stuck by even when you've been accused of fake news and all sorts, and helped us communicate with the public. And you know, I'm sure that is part of the reason that where we are now. So again, if you have any insight, if you get any feedback about what works and what doesn't, please do feel free to share that with us, because you're the experts and we're absolutely here ready to listen and learn.
Laura, sorry to turn the tables on you there, but did you want to reflect on that question back from Lucy? Thank you, Laura.
well, I'll go away and have a think about it, and yes, yeah, come back to you. But I would just say, I mean, obviously, Lucy, you're doing your regular slots, and when you were away, Rosin was in your place, and that is helping it with our listeners, and we have had feedback in that way that listeners have heard your messages going out on the radio station. So from a radio point of view, that's been really helpful. But yes, I'll have a think about that and come back to you on the other points.
Thank you very much, Laura. And it goes without saying that the comms team and the public health team, and in fact all the teams and the media, have worked extremely hard across the piece here. It is definitely very much a team effort, and I think the results of that are being shown across the county. So I think everyone, although shouldn't be celebrating, it's very good news that we're all working so well together. I'm looking around the room. I don't think there's any further questions, in which case I will close the press conference. Thank you very much for attending. Thank you for the questions. Thank you for the answers. Have a good weekend, everyone, and stay safe, and let's follow that guidance. Have a good weekend.
Thank you. Bye-bye.
Thanks, Ian. Thanks, everybody.
Bye. Bye, everyone.